A particular passion of mine is revision rhinoplasty, a term that basically talks about fixing someone else's nose job or fixing someone else's rhinoplasty. A lot of times places that do rhinoplasty are not specialized in rhinoplasty. As I mentioned in my introductory video for this website, I'm double board certified in ear, nose, and throat, as well as in facial plastic surgery. So I'm very passionate about nose jobs or rhinoplasty and correcting rhinoplasty. So when we talk about revision rhinoplasty, I can spend hours telling about all the techniques I use to correct noses. It goes beyond the scope of this video because I can't talk about every single permutation out there. But I want to talk about categories to help you understand it. There are really, two components of a revision rhinoplasty. One is a functional rhinoplasty correction, and the other is a cosmetic reconstruction. So actually, to clarify this, there's also a term reconstructive rhinoplasty, and that's something talking about cancer reconstructions. I'm not talking about that. I'm talking about you had a cosmetic rhinoplasty that you don't like or you can't breathe. So the functional component is so important because if you've got a beautiful nose after I've revised it and you can't breathe, that's a problem. So I do a lot of revision rhinoplasties just so that you can breathe better, and oftentimes it's both. The problem with traditional rhinoplasty, especially rhinoplasty performed 15, 20 years ago, is that rhinoplasty was much more destructive. It took away a lot of the cartilage, removed everything. If you listen to my rhinoplasty virtual consult, I'll tell you all the methods that I go through in terms of preservation, and I mentioned in my introductory video and also in my virtual consult how I actually make your nose stronger. And not just weaker, but stronger. And so a classic example of functional problem is what's called external nasal valve collapse, which essentially means is when you look in the nose, you see the nostrils collapsing in. And it's like a roof of a building falling in during dynamic movement of the nose or breathing. And so that's due to over trimming this cartilage here. I create a very strong rigid support, and I oftentimes can get the nose to either not collapse at all or just barely move in to the point where there's not this functional problem if you're breathing hard, exercising, whatever it may be. So that's one type of functional collapse. Again, to cover every type of valvular collapse and type of structural problem for breathing problems is going beyond the scope of this, but I just want to talk about one very common functional problem. Cosmetic problems, it's a whole gamut from distorted bridges, over scooped out noses, collapsed sides, traumatic asymmetries, to tip over rotation, under rotation, over projection, all those things. Now, I always say with a revision nose, I cannot make it perfect, okay? All I'm trying to do is improve things. So my goal is to try to make it functionally strong, and also a nose where if you are in presence of someone else, you really don't notice that the nose has been done. It looks as natural as possible. Those are the sort of the key elements in this introductory video about revision rhinoplasty. Again, I'm just giving you some introductory thoughts. I encourage you to watch my other videos on rhinoplasty and sort of find the ones that can be tailored to you, like ethnic rhinoplasty, male rhinoplasty, or whatever it may be. But this hopefully will give you just a general concept about why I'm so passionate about revision rhinoplasty and how I perform it.